שמי ליאורה באוורס ואני סמנכ"לית מרכז טאוב וחוקרת בצוות היוזמה חקר להתפתחות ואי שוויון בגיל הרך, ואני אנחה את הדיון במושב הבא. כעת נשמע הרצאה מאת קתרין מגנוסון, פרופסור לעבודה סוציאלית ומנהלת המכון לחקר העוני באוניברסיטת ויסקונסין במדיסון, בנושא עברות כספיות בלתי מותנות ותהליכים משפחתיים. ממצאים מהמחקר שנותיו הראשונות של התינוק. לאחרי ההרצאה הזאת של הדיון נשמע מפרופסור ציפי הורוביץ-קראוס, ראש הקבוצה לדימות מוחי בילדים, פרופסור חבר בפקולטה לחינוך מדע וטכנולוגיה וחברת סגל בפקולטה להנדסה ביו-רפואית הטכניון. לאחר ההרצאה של קתרין, הדיון במושב יתנהל באנגלית, ולאחריו נקדיש זמן לשאלות ותשובות מהקהל. ניתן לשאול שאלות או באנגלית או בעברית, וצוות מרכז טאוב יתרגם. So we were very happy that now we will hear a lecture from Professor Katherine Magnuson, Professor of Social Work and Director of the Institute for Research on Poverty, University of Wisconsin-Madison. After that, we will have a discussion with Professor Tzipi Horowitz-Kraus, Head of the Educational NeuroImaging Group, Associate Professor in the Faculty of Education in Science and Technology, and the Faculty of Biomedical Engineering, the Technion.
Good morning or good afternoon, everyone. I'm happy to be with you here today to share some exciting findings from the Baby's First Year study. Before I begin and jump in, I want to give acknowledgement. This is a very large project, and I've been working with my colleagues on this for over 10 years. There was a lot of planning that had to go into it. So I want to acknowledge Kim Noble, who is my collaborator at Teachers College. She's a neuroscientist. Greg Duncan is an economist at UCI School of Education. Nathan Fox is a neurodevelopmentalist. He's at the University of Maryland. Lisa Janetian is an economist at Duke in their public policy school. And Hiro Yashikawa is a developmental psychologist at NYU. We also have my own colleague here at UW-Madison, Sarah Halpern-Meakin, who works with us by running our qualitative study, which I won't have time to tell you much about today, but we're very grateful for her in that she has really helped us learn from the mother's eyes their experiences with our project. And then finally, it's always important to uplift the emerging scholars. Sonia Troller-Renfree is a neuroscientist, and she's joining Teachers College as an assistant professor this coming year. And Molly Costanzo is a postdoc at UW-Wisconsin with her PhD in social work. So what I'm about to talk to you today about is some science that we have been working on for a long time. But I feel like whenever we are talking about our findings and our science, the most important thing for us to do is to first thank both the communities and the families who have been part of this project. It is a lot to trust and partner with us, and we are grateful for their commitment and their support and their participation. And we hope that we will be collaborating with them for many years to come. Now, when we started this project, all of us who are working on it many of us who are working on it as the PIs, we came to this from having studied in the US context changes in welfare programs. And we know that across the world, but also in, again, the US context, there are many different policies which affect family incomes: taxes, nutritional assistance or support, housing subsidies. And in many of our policy debates, what becomes focused on is how the adults do. Are they working more or less? Are they able to pay taxes? You know, what happens to the adults? And we felt very strongly that that's a short-sighted perspective on the well-being of a community. And particularly important is understanding how policy changes that affect family income will affect children, right, as they're embedded in these families, and they are the children of the parents, what happens to them? And we know from long literature in the social sciences that there is correlational and suggestive evidence that differences in income, and again, in the US context, about $4,000, can predict later outcomes. It predicts children's cognitive development, their school performance, whether or not they're graduating from high school. And then, interestingly, also when they're adults, how much they're earning, how much they're employed, and their health. Now, this is very compelling evidence, but it also is truly correlational. So it's really hard to know that it's differences in the income that are making a difference rather than other family background differences that might be affecting children as they grow up. And in particular, there's some good quasi-experimental evidence, mostly related to policy changes and a few other things like casino openings, again, in the US context, that suggest that income matters later in life, in adolescence or later childhood, but nothing that was focusing on young children. And this is largely because young children are somewhat harder to study. They don't show up in administrative databases. And they're not already enrolled in a study when a policy change happens. So we were really focused on trying to understand the causal effect of income on children's development during early childhood. And this is the time when we know that brains are especially sensitive to early experiences. So we designed a study to do just that. It's a randomized controlled trial looking at the impact of cash transfers in order to help us learn more about what poverty reduction and these cash transfers can mean during early childhood for development. In this RCT, we launched it, started recruiting families in May of 2018, and we recruited 1,000 low-income mothers in a hospital maternity ward right after giving birth. So that literally means we had field staff going into a hospital room and asking a mother first if she was eligible, and then if she would participate in a longitudinal research study. We did it in 4 metropolitan areas in the US, New Orleans, Omaha, the Twin Cities, and New York. And we picked these because they varied in the demographics of the types of families they served with respect to race and ethnicity. We picked them because they differ in the US in terms of their policy generosity. So New York and the Twin Cities provide much more support to low-income families than does, say, New Orleans. So we wanted some diversity for the types of families being served. We then, after mothers participated in a baseline survey, we literally gave them the opportunity to join a lottery. And the lottery had 2 outcomes. About 40% of the mothers were going to receive $333 a month. That's about $4,000 US a year. And it was going to be loaded on a debit card so that they would get it every month. And then we wanted to have a comparison group that would help us understand the impact of the money, but that would have the same access to the debit card. So 60% of the group, of the 1,000, got a what we call a low cash gift, $20 a month. That's about $240 a year. Now, originally, when we planned the study, we were going to be giving the gift for 40 months. That's just 4 months past the child's 3rd birthday. We were in the context of the pandemic, and we knew that we would be unable to collect the outcome data from the children that we were hoping for. So we went ahead and extended the payments to 52 months. That would allow us, we're just starting next week, actually, we'll be calling moms to bring them in and get new data collected when the children are 4 years old. And at this point, we are thinking that we're going to be able to actually even extend the cash gift longer to 76 months, and that's just past 6th birthday, with the idea that we'll be able to say something about cash support for the entire period of early childhood, right up until, in the US context, children are in the formal school setting. Now, we have a developmentally informed theory of change. We don't think money in and of itself, just having it sit in your pocket, is going to do anything. But what we understand from prior literature is that there's 2, somewhat simplistic, but 2 pathways by which increased income, reduced poverty, will help children and families. And the first is that we know that money actually can provide things that are good for children, and that when parents have more money, they'll spend it on things that are good for the children. So this is everything from books to toys, higher quality childcare, more regular health care. Some families, it might mean that they can move apartments and neighborhoods. And for other families, it means that they can maybe get a car so they can drastically reduce their commute time and spend more time with their children. So it's literally the pathway by which parents deploy the money. They know best how to spend it themselves in ways that's going to make their family better off and support their children's development. The other way in which theory has suggested that money can really help families is by reducing their psychological distress. And that's both stress, but also things like bandwidth and improving attention. So we know in the US context for many low-income families, just simply making it through a month and being able to pay for everything that they need, formula, diapers, especially for young children, it's quite expensive, is a very complicated, time-consuming, and stressful experience. So we think that providing mothers and families with regular cash support, that they may experience less of that psychological distress, and that may enable them in turn to have better relationships with their children, to be interacting more, to be more warm, more nurturing, and less harsh. So those are the pathways that we are interested in studying and believe might lead to have higher levels of cognitive, socio-emotional, and brain development for the children who are in the BFY families. Now, it took us, as I said, we were planning the study for quite a while, and part of the planning was trying to figure out how to give away cash in the US context. What we landed on was a debit card, which was branded with "For My Baby," so it's a little bit of a nudge for the mother to think about the baby in terms of spending. And it's dispersed or loaded onto the debit card on the same day of the month that the child was born. So my youngest child was born on November 3rd. If I was in the project, then the 3rd of every month, I would have my dollar amount loaded onto the card. And we also provide text reminders for each disbursement, so moms know that it's loaded. And we also provide a call helpline. There's a little number on the back of the card, which is to us, not to MasterCard, so that we can help with any issues that come up or any questions that mothers have. Now, it's funded by charity philanthropy. It's not government money at all. So we did not need to get Social Security numbers for individuals. In the US context, this is important because many people are uncomfortable providing those numbers, concerns about government involvement, particularly around immigration. It's not taxable, so they don't have to report it as income and pay taxes on it. And most important, and again, this was a large part of our planning process, we were able to get agreements from state and local governments so that they won't lose eligibility for other public welfare benefits. So nutrition assistance, childcare subsidies, any other state cash assistance does not get reduced because of this benefit. And in the US context, that typically would happen. If you got $4,000 more of income, you'd have to pay more, you'd lose some of your other public benefits. And to date, we've put over $6 million in the hands of the mothers who are participating in BFY. Now, I'm going to give you a quick roadmap for where the rest of the presentation is going. I'm going to share with you some findings on infant brain activity that Sonia Troller-Renfrey led and was published in the Proceedings of the National Academy of Science earlier this year. And then I'm going to provide some findings on different aspects of family investments and process. These are analyses in progress with draft papers written but not yet in press, so you get an early look. And then afterwards, when I'm done with the presentation, you all will have time to ask questions of me and get information clarified. I'm sure there's a lot of details I'm leaving out that you'd be interested in hearing about. So let me tell you a little bit about our sample. So in a randomized controlled trial, the first thing you have to worry about is making sure that the lottery process works and that the groups are balanced. And I'm happy to tell you that on 30 characteristics that we've measured, there is balance across our sample. So the randomization worked. We have a diverse sample. They're about 40% Black, about 40% Latina, and that's both Mexican, Dominican, and Honduran, so it's not just one group there. About 20% of our sample is married. Another third of our sample is living with typically the father of their baby, so a romantic partner, but not married. And then about the remaining, I can do this right, the remaining 40% are either living on their own or living with other family members. About 60% of these moms were working while they were pregnant or working outside of the home. And many reported plans to return to work. The average household income. So to be enrolled in the study, you had to have a household income that fell below the US poverty threshold. So for a family of 3, that's about $24,000. And you can see that this sample of mothers reported a household income of about $22,000. So that's, in the US context, that's really quite low. And it also means that the $4,000 that we're providing constitutes a little less than 20% of their income. So while it's not the most generous cash transfer that you can imagine, it does represent a significant part of their income. And not surprisingly, as these are low-income mothers, most of them reported receiving some types of public government benefits. The great news about our study, or a highlight of our study, is this is a population that is mobile, busy, hard to track, but we've had incredibly high research participation retention rates. So we just stopped our 3rd year of data collection. And again, we have over 90% of that baseline sample participating in data collection. And we're incredibly grateful. We partnered with the SRC at the University of Michigan, the Survey Research Center, and they've been incredibly successful in engaging our mothers in data collection. Now, it's an ambitious project, and it's been going for a while, and it's not done yet. So let me give you a sense of the timeline. We started recruiting mothers, and we did a year of rolling enrollment. So it went from May to June of 2019 to enroll our 1,000 mothers. And really all we did at baseline, other than get consent to participate, was a baseline survey. We did ask for permission to follow up for a subsample to participate in a qualitative data collection. And we have mothers that are doing that in New Orleans and the Twin Cities, about 80 mothers total. And we also requested permission to go to state and local government and get administrative records on things like public welfare receipt and other services. In 2019, we started our age 1 data collection, and we were about 2/3 of the way through, a little less than 2/3 of the way through when the COVID pandemic occurred. So at that time, we'd been doing in-person data collection. We had a survey. We were videotaping parent-child interactions. We were collecting hair samples to get a measure of mom's cortisol stress. And we were lucky in that literally months before, a company had produced, developed, and put on the market a mobile EEG cap, so that we were able to be collecting information. I'll say more about this when I get to these findings. We were able to be collecting brain activity in children's homes, which is pretty phenomenal. Unfortunately, with COVID, all of that had to stop. We quickly were able to pivot and just continue with phone interviews. And we have been doing phone interviews ever since. So our age 2 was a phone interview with a mother. Our age 3 was a data collection, was phone with a mother. And you can see the gold star where we are, middle of 2022. We literally next week will be starting to schedule in-person laboratory sessions where we'll be able to get another survey, but most importantly, we'll be collecting in-person assessments of child's development. So again, another assessment of brain activity, cognitive, behavioral, and physical development, and direct assessments, which is really important for young children. Parents are good reporters, but really not great reporters of their children's development. So one lesson is stay tuned. There's a lot more coming when we have this year for data. Okay, so I'm going to jump into the findings from our Proceedings of the National Academy of Science paper. And the first thing that I want to say is that while our study is interested in understanding the impact of poverty on the brain, our interest in the brain really stems from the fact that it's just a central part of developmental processes, and one that is sensitive to experiences and is in some ways a precursor to understanding children's later development, which is to say, if you take a 1-year-old and you track how many words they know or whether they can walk, that is a very, very blunt way of understanding how they're doing. And the neuroscientists on our team will tell you that brains can provide information that maybe is not obvious through these other metrics that have been developed. So we are interested in the brain, but only because it provides context about overall developmental processes. And we in no way think that impacts on the brain are more important than broader impacts on school readiness, mental health, and a range of other critically important outcomes. So the neuroscientists will tell you that we use electroencephalography, EEG for short, to measure infant brain activity. Now, this is a cap that's placed electrodes actually on the scalp, and it's incredibly great for young children because it's safe, fast, and simple. So for those of you that know more about brain development, you think of things like MRI or fMRI, where you go into the tube. It is impossible to do that type of data. It's not impossible, but it's impossible to do at scale that type of data collection with children who are 1 year old. Now, the EEG cap is used to measure children's brain activity. And it really works like a microphone, right? You have electrodes that are placed at the surface of the brain, and it is amplifying the activity that's happening in the brain so that we can then record it. And brain activity happens at different speeds. There are fast speeds or fast oscillations. Those are your gammas and your betas. And then there's medium, alpha, and a much slower wave called theta. And so when you're processing brain activity data, when you're processing the EEG data, what you're doing is breaking it down into these different brain speeds, these different speeds of brain waves. Now, early in life, at birth, they have done studies where they get mothers to agree to have their infants' brain activity measured literally when they're born. What you see is that there's no difference, and these are correlational studies, so take them with a grain of salt, but you don't see differences in brain functioning or brain activity by SES. But if you fast forward a few years, a year or two, they start to emerge. And so this is why when we were designing the study, hypothesized based on these data that we were going to see differences in brain activity. So children who are living in economically disadvantaged environments often show less of the higher frequency power. This power is associated with an alert state, focused attention. So you see less of that focused attention, high frequency power, and you see more low frequency power. And this is associated with sort of a drowsy, sleepy, less attentive state. So we hypothesized that by providing the cash gifts, we would see more of the high power, more of that attention and focus, and less of the lower frequency, less of the drowsy. It turns out these patterns are associated with later school readiness and cognitive development, including language outcomes. Again, those studies are correlational, so it's very suggestive. It doesn't predict, one-to-one that we know that this will lead to better school readiness, but it's a pattern that's associated with it. And this is what we expected to find or to test, really, in our study. So I mentioned that there was a new mobile cap that we were able to use, and it was developed literally right before we were hitting the field. So much so that I think the very first early efforts, we had some technical problems with it, but we worked really hard to make sure that families were comfortable. We had videos and FAQs and customized caps, because you really have to make sure that the sensors can get to the skin, and so different hairstyles can provide challenges. But you can see pictures of this little cap and the children. Amazingly, we did pretty well. We worked hard, and the majority of the families agreed to try it. At the end of the day, we got 84% of the babies were successfully capped. They won't be successfully capped if they start to fuss. We call it fussing out, if they're crying, if they're upset by the cap, if they're scared. And at the end of our effort, we ended up with 435 children who provided usable EEG data, and that's 72% of the in-person sample. You recall that because of COVID, we had to stop short this data collection, so our sample size was significantly lower than we had hoped when we started it. This is what we predicted, and I'm just going to give you a visual. Along the bottom is the different bands of hertz, that's how they're measured. And you can see that in the theta and the alpha, in the theta region, we expected the high cash gift group to have less theta. The high cash gift group is represented by the darker line, the black line, and the low cash gift is the gray line. So we expected to see this pattern where the high cash gift group had more beta and more gamma and slightly and less theta. And what I'm going to do is jump ahead and show you what we saw, which is close to what we expected, but not exactly. So it turns out that we see a pattern of less theta, but it's not statistically significant. That's not large enough to suggest a real difference. But we do see differences as expected with respect to more of the beta and the gamma, more of the high frequency oscillation in our data. Now, again, I'm not a neuroscientist, but I do work with them. And one thing that you can do with EEG data, in this screen, we're looking at whole brain activity. So it's the different bands, different speeds of oscillation across your whole brain. But what you can do is also look at it in a regional way so that you're looking at where in the brain is it happening. And this is just a visual representation to show you where we saw more of the fast-paced brain activity in the high cash gift group. So both the alpha and the gamma, and you can see it's right in that central region. Now, I'm going to pivot. I just summarized our PNAS findings. So I'm going to pivot now to talk more generally about how families are using the cash gift and what we've learned about their changes in family process as a result of the cash gift. So what have we learned about it? First, we learned that there are very few problems the moms are able to use the debit card. And generally, they use the money that's on the card quite quickly. The largest single way it's used is being taken out at ATMs. But we see a lot of different ways in which it is spent. And another large way is at what we call here in the US big box stores. So these are large Target or Walmart type stores that sell a lot of different types of goods at relatively low prices. But you can see they spend it at a car wash, transportation, auto supplies, grocery stores. It's in all sorts of places. Now, in the US, you can buy alcohol, depending on where you live, in a big box store or a supermarket, or in some states, you can only purchase it at a specified store that only sells alcohol or tobacco. And so we see very few transactions in those types of specialized alcohol or tobacco stores. What I want to do here, so this is going to be showing you mean differences in a variety of income. So one of the things you might wonder is whether when you provide money to people, cash money, unrestricted, unconditioned, as we are, whether they change how much money they're getting from other sources. So maybe they'll work and earn a little bit less, or maybe they will not apply for a public benefit not because they aren't eligible, but the hassle is too much. And essentially what we find is that about $282 of the cash gift remains. So there is a little bit of decline in other places, most of it not statistically significant. But at the end of the day, when you look at how much money the families are reporting that they have coming in a year after they've been getting the gift, there's a $282 difference between the low cash gift group and the high cash gift group. And you can see the low cash gift group overall is reporting about $1,900 of income, and the high cash gift group is reporting about $2,100. And that is a significant difference, as we would expect, providing the cash income is increasing their overall economic resources. And if you go all the way down to the bottom, we have income to needs ratio, which is really the percent that are in poverty. If it was 1, then everyone would be right at the poverty line. And so what you see as with the low cash gift group, about 80% of them, or they're meeting 80% of their family needs. And when it increases in the high cash gift group, it's a difference of 9 percentage points. So they are about 9 percentage points less likely to be in poverty. This is really showing you how the $313 translates into $282. So there's a little bit more maternal earnings, a little bit less of other household earnings, a little bit less government income, and a little bit less other income, miscellaneous income, if you will. Now, so here's what we know. Let me just get this all on the table. Okay, so here's what we know about the family processes and family well-being. We see slightly reduced poverty, right? So this is the increase in household income that I was just showing you. We also see that mothers are spending more time engaging their children in reading, telling stories, and playing with your children. So we ask them a set of questions about how often they are doing these things with their infant, and they report doing it more often. So it's about a 6 percentage point difference in how often mothers report that they are regularly engaging in these activities with their children. We also see an increase in child-specific goods, and these are things like books and toys that you would spend for your child. And the difference in the first year is about $63. So we're seeing that a portion of that increased money that families have is being spent on things that are directly specific or directly targeted for their children. Now, there's also a range of things that we ask about, which we're seeing no differences between the high cash and the low cash gift group. And again, the reason that we compare the two groups is because we know that they're similar on all baseline characteristics. We know that they're a similar group of families. One set of the families, the high cash gift group, is getting this extra money. The low cash gift group has a debit card and it's getting $20 a month, but the difference between them, that $313, is really able to identify or indicate when we see differences between the two groups. If the only thing that is different is that amount of money, then we know that those differences between the families is due to the money. So where we don't see differences so far is most measures of material hardship. So we ask a series of questions about whether they're having trouble paying bills on time, whether they have ever experienced homelessness or been evicted from their home. We don't see differences in that. We also ask a set of questions about how chaotic the home life is, to the extent to which there are routines, noise, lots of people in and out, regular plans. We don't see differences in that as a function of the cash. We aren't seeing differences either in the quality of housing or in neighborhood quality as reported by the mother. So you can think about using measures from our census that maybe would look at poverty rates or crime rates. We don't have that information yet, but this is simply the mother saying whether she finds her neighborhood safe to walk in, to go out in at night, that sort of thing. So we aren't seeing differences there. We're also not seeing differences on a range of mental health, happiness, life satisfaction, or self-esteem or self-efficacy measures, which is really what the HOPE measure gets at. So you'll recall we had a theoretical pathway that said, well, maybe providing cash to mothers will reduce the stress and reduce psychological distress, improve mental health. And we really aren't seeing, at least in this age 1 data, indication that it is working to do that. And then finally, this is a null finding that is potentially useful, at least in the US policy context, which is we did ask mothers how much they were spending on a set of goods that are certainly adult focused, but also maybe not considered healthy. And so we don't see mothers reporting that they're spending more money on alcohol or tobacco in the high cash gift group compared to the low cash gift group. So we're not seeing that the money increased spending on those goods. Oh, we also, sorry, that came in a bit late. We also aren't seeing differences in mothers' patterns of work. So we don't see that mothers are entering the labor force more quickly after the birth of their child, or that their children are spending more time in non-parental care, in child care, whether that is informal or formal. Now, one of the things that we try to really focus on or really hit home in terms of our messaging is to simply say that what I presented with you is really just the first year of data. And we have now designed this as a 4-year study. So trying to draw firm conclusions about what the impact of these cash gifts is really premature. It's kind of like trying to study the impact of college after just someone's first year. We know that there's a lot more to come. We're also really eager. We have this qualitative study that Sarah Halper and Meakin is running where we're hearing directly from mothers. And I think one of the most consistent things that we hear is how the money is spent differently by different families. So it really does mean different things to different families. Some initially were using it to buy just basic needs, a car seat, food, turning their lights on. Whereas we hear from other mothers that it enabled them to start a small entrepreneurial business. They were able to use the cash to buy supplies to grow a sewing business, for example. So we know that we're going to learn a lot more from these interviews and from the process of hearing from moms in their own words, how they think about the money, how they're spending the money, and then many other things that are going on in their lives. But finally, as we're literally next week on the verge of starting to collect the data collection, we're going to learn a lot more this coming year about child health, literacy, behavior, more EEG data, mom and child stress, which can be measured from hair in a form of cortisol. We're collecting information on mom's mental bandwidth, and that's really sort of, do they have more brain energy or cognitive energy because they're not focused so much on trying to make ends meet. And then finally, some other biophysiological metrics that can tell us epigenetics, which can really tell us how quickly biological clocks are working. So it's a shorthand for biological aging, is the cash slowing down biological aging in a beneficial way. So in short, a lot more to be learned. We're really at the beginning and we have a ton more data to be looking through. I want to pause here. I noted my team members. We have a large supportive group of funders and students that are working with us, and it is truly a team effort. We wouldn't be able to do any of this without all of their support and help. I look forward to hearing what questions you have and a lively conversation about what these findings might mean for later on in terms of kids' development, but also for what they might make you think about in your contexts, in your communities. Thank you.
Hello. I see her on the screen. That's why I'm saying hello. Hi. Hi, Catherine. It's just me that's seeing you. Hi. Oh, there you are on the big screen. So I need my presentation in a second. Okay. In the meantime, I'll say hi. Hello, everyone. My name is Tzipi Horowitz-Kraus. I'm from the Technion in Israel. And also from Johns Hopkins Kennedy Krieger Institute in Maryland. I am a biologist in my background, but along the years, I fell in love with the educational field, with child development, and specifically with brain child development. And this is my specialty. This is what I do in the past 20 years. And today, oh, they still don't see the presentation. Today I will talk about the critical period for brain development, and in a way it will complement the amazing talk by Katherine. Thank you so much for this talk. And I will actually start from the end point, which are the results that we are really eager to hear from Katherine in like 2-3 years of what's happening when these kids get to school. So how ready they are, how much their brain is ready to learn new things, to learn how to read and to do math, and also how it affects their well-being. So you can see my young Noga here in the scanner. All my kids are participating, are participants, volunteer participants in my studies. A couple of words about what we do. I come from the Technion. We have a new neuroimaging facilities now. I work with EEG and with MRI, although Katherine said it's almost impossible. Well, it is possible, really, really challenging. You need to really love kids in order to do that and to really be a great believer in what you do and the importance of it. And that's why I came here from the United States to Israel to empower and expand this field. And it's almost like creating this field from scratch here, because for some reason, and maybe we can talk about that in the discussion, the medical model in Israel that every disease, every medical condition has some kind of a physiological marker that will then make the individual be eligible for medications, for resources, right, for funding. It doesn't really apply in education and child development. And that really frustrates me, because I know that every child needs to have a fair chance to fulfill the full potential. And for that, you need to have the genetic component, but you also need the environmental component. And especially in Israel, the stress, the socioeconomic status, the multiple religions, the differences in education system, it's so variable that a specific study needs to be done in Israel. We cannot really learn. We can learn from studies around the world, but it won't be similar to what we know and what we have here in Israel. So this is the ideal and idea of why I came here and my attempts to develop this field here. So a couple of words about the outcome, where we want the kids to be, in addition, of course, to well-being, but my specific research is about reading, kriya. And I will merge some Hebrew words. I know that I don't have like a simultaneous translation here, so I will jump from Hebrew to English. I used to do that a lot. So, you know, reading is a relatively new human invention. We think that it was here forever, but it was actually relatively new, 5,000 years-ish old, starting from the Egyptians' age, as you see here, the Egyptians' era, whereas pictures were translated to spoken words. This is very, very intuitive. But 5,000 years forward, and we expect young children to get into school, first grade, and just get it. Okay, and this is not that intuitive. Can we avoid reading? Can we say, okay, we're not going to read, that's fine, we're just going to use emojis? No, we cannot, because in the road, when you're driving, you have signs, you need to know where you are. In the text, there are social group texts, and a child that wants to be active socially needs to know how to read without errors, without typos, because then other kids will think that the child is not smart enough, right? And of course, in captions and movies and so on and so forth. And if you look at the brain and the reading network in the brain, you'll see how complicated it is. And for the English speakers, you see the words here and what it represents. For the Hebrew speakers, I will say that what's needed is גישה למילים, כמו שאתם רואים כאן בכתום, יכולת monitoring, to understand why am I supposed to be doing, what am I supposed to be doing, לשמור את הקשב במקום כל הזמן, כמו שאתם רואים בוורוד, top down attention, קשב למעלה למטה, כמו שאתם רואים כאן בצהוב, and access to words and to holistic templates of words, as you see here in blue and in red. גם באדום וגם בכחול אתם רואים בעצם את האזור שאחראי על הגישה ללקסיקון המילים שלנו, ליכולת שלנו לזהות מילים באופן תבניתי. It is really unnatural for the young brain to do this very complex activation and to do it in a very precise timing. It needs to be very precise. Now, how does it happen? For me, it's magical. Okay, so starting from birth, and we have some evidence from neuroimaging data of children that, or actually fetus, that was imaged while in the mommy's tummy, that the young brain is sensitive to language, to sounds, okay? So even in the tummy, there is sensitivity. The neurobiological networks are already there and start developing. And they start developing, yes, naturally, but if they get the environmental stimulation, the brain networks will be more connected, they will be active more efficiently, and will be able to facilitate reading acquisition. אז בעצם, במילים אחרות, אנחנו מכינים את המוח הצעיר, עוד מגיל לידה, ואפילו עוד קודם לכן אפשר לומר, עוד מגיל לידה מכינים את המוח הצעיר ללמוד לקרוא. אנחנו מגרים אותו בשפה, בספרים, כמו שאמרה Katherine, בספרים, ב-literacy materials that are so important to have in the household, and the linguistic materials that they hear, as we said earlier, especially from the mother. So this is just in the background, you saw these beautiful images of EEG that Katherine showed earlier. And I have to say, Katherine, I'm really, really appreciative of your longitudinal study. As a neuroimaging scientist, I know how hard it is to collect neuroimaging data in young children. You need to be entertaining. You need to be very active and energetic to make sure that you get good quality data that represents the child's ability, right? And so MRI data, neuroimaging data, or to look at the brain, we can look at it using MRI, as you see here to the left. We can look at the structure of how well the brain develops structurally, or we can look at the function, how well it functions when we present specific stimulation. Or we can look at EEG, as Katherine showed in her presentation. We can see what's happening when we present a specific stimulus, or we can look at ongoing processes like what Katherine showed you earlier with the frequency results. So in short, what is happening in the first couple of years of life? So first of all, massive growth of connections. הרבה מאוד קשרים נוצרים בין תאי עצב. הקשרים האלה נוצרים באופן טבעי, אבל הם ייווצרו, מה שנקרא על סטרואידים, ייווצרו עוד יותר אם אנחנו נעשיר את הסביבה של הילד. כמובן, העשרה של סביבה צריך לקחת אותה בקונטקסט הנכון, כן? יש הורים שחושבים שהעמסה סנסורית היא מאוד מאוד טובה. גם לי זה קרה בילד הראשון, זה בסדר, אני חושבת, עוברים לגור בשילב כמעט, אוקיי, אבל בהתאמה לגיל הילד, אוקיי? ולאחר מכן ישנו קיצוץ, מה שנקרא pruning of specific regions or specific connections that are not in use. And I like to look at it as a field, you know, as a forest. At the first years, you need to shower it with love and sun and water and rain. And then a gardener comes in and fixes everything and reorganizes whatever that is not in use. And here what I want to show you, because I have only 3 minutes left, I wanted to tell you that why is it so important to invest in this age, in the first years of life. And it's like preaching to the choir, I know, but still I like to show these results. What you see in this very busy slide is the brain functional networks. So the networks that are responsible, as I said, for seeing, for hearing, for paying attention. At the first month, you see the first month here, second month here, third month, in different sensory and motor abilities. So you see, for example, the sensory motor network, הרשת החישתית והתנועתית, at the first month of life, look how similar it looks like to the adult's brain. And you can see the same thing in the auditory language network, how much it is similar to the adult's brain. Which means, and we can go on, and these are the networks that are related to what Katherine showed earlier. We can see it also in fMRI. ומה שאנחנו יכולים לראות כאן, שבעצם הפעילות המוחית בגיל חודש היא מאוד מאוד דומה לפעילות המוחית של מבוגר. ועד כמה חשוב לתת שם בחודשים הראשונים את מה שאפשר לתת מבחינת ההשערה. אז אני רוצה רק לרוץ, I want to give one of the results from our lab, since I don't have lots of time, that these networks that are, again, very similar to the the frequencies that Katherine showed earlier, support language processing, listening to language, which we think that is very intuitive. Every child listens to language and comprehends it. Pay attention how much this network, for example, the singular percular network that is in charge of monitoring and paying attention to what we hear, is involved during stories listening. ילדים רק הקשיבו לסיפורים פה, זה מה שהם עשו. אבל הרשת הזו פעילה יותר ויותר לאורך ההתפתחות. מגיל 18 חודשים, סרקנו ילדים ב-MRI, בגיל 18 חודשים השמענו להם סיפורים, והרשת הזו הפכה להיות יותר ויותר מחוברת, וככל שהיא הייתה יותר ויותר מחוברת ומגויסת בתהליך שמיעת הסיפורים, כך היכולת השפתית של הילדים, שגם אותה בדקנו, הייתה טובה יותר. So it's really important to have these networks as part of the overall enrichment in the child development. Here is the data, and that's the last slide I'm going to show. Sorry, no time whatsoever, of a data that we collected at the Technion, looking at parent-child interaction during stories listening, storytelling. And there's a big method, very familiar in the United States, called dialogic reading, קריאה דיאלוגית, whereas the parent telling stories to the child in an engaging way, lots of questions, eye contact, etc., etc. We did a wonderful study in daycare at Haifa with a group of kids, but here we did that in children that were 2 years old with their mothers, and we looked at the brain of both the mother and the child together, how well they're synchronized, how well they are talking to each other. Why is it important? Because for some of you, כשאני מסתכלת עליכם עכשיו, ואני רואה את הקשר עין, ואתם מסתכלים ומהנהנים, אני יודעת שאתם איתי, right now, on the same page. And this is exactly what's happening when the parent and child together, and we can measure it using brain techniques. It's really hard to measure it without brain techniques. We can do something like that, like different algorithms that we can say, okay, when the attention is joined right now, but it's harder to do. It's easier to do it with EEG, sorry. So in a condition that the parent and child were telling a story together, there was a higher brain synchronization between the couples. Now, when there were some interruptions, and this interruption is when the mother is telling a story, the mother is getting some text messages in the middle of the story. You can look at the facial expression here of little Noga, like, what is more important now, huh? Now, we were interested in that because this is an example of interruption. An interruption that can also occur in high SES families, and maybe even more. I don't know. You know, some people just don't know how disruptive it is to the connectivity, to the connection between the mother and the child. How fast does it take to get back to this synchronization? We don't know. What is happening in low socioeconomic conditions whereas in the house, there are different types of interruptions, right? There is background noise. Sometimes people don't think that it's that important. People are over talking with each other. So we found decreased synchronization, as you see here, compared to the increased synchronization. And I will finish up by putting this and leaving this on the screen, saying that it's really important to look at the child from different perspective, exactly what we're doing here. Not just on the potential and the genetic potential, but also on the nurture, meaning what is the positive stimulation that the child is getting, maybe through investments like we saw in the previous talk. What is happening when there is no stimulation, like ignoring the child or not providing enough positive reinforcement, and what's happening when there's a negative environmental conditions with involving stress. And can we change that? Can we move kids from one quarter to the other by providing these interventions? Thank you so much. I'm sorry for taking 2 extra minutes. And I encourage all of you, please, if you know of someone that will be interested in participating in our wonderful studies, and you took away my slide. Why is that? Please reach out to me. We really, really want to bring this field and put it on the map also here in Israel. Thank you so much.
I think here so that we can see Katherine.
So here is good?
Oh, yeah, that's good.
It's like a COVID distance.
Very safe, yes. Thank you both so much. That was fascinating. And Katherine, I have to thank you for being up really early, your time. So thanks for that. I'm wondering if in continuation to Tzipi, what you were just talking about, also with your example of the MRIs for the children who had stories read to them, and we saw the impact on brain activity, if we could delve a little bit more on the issue of the theory of change. Katherine, you had presented both directions of the investment model versus the stress model. And it looks like from your initial data, what you're seeing is that the investment model seems to be stronger in that you're seeing effects on parents spending time with the children, purchasing children activities, but perhaps yet not so much change on the family stress side. So I was wondering if you could elaborate a little bit more on that.
First word of the morning. So yes, thank you. I think that's right. I want to be careful. We don't mean to set it up as an either or, that it could be one path, that it's only one pathway that could be operating. There's a long literature supporting both pathways. I think at least early on in these first year of data, we aren't seeing differences in maternal psychological distress or overall stress. Now, this is a study of newborns, right? So those of you that have had children remember what it's like to have a very young child. It may not be the most unstressed time of your family life. And so I think we're interested in seeing over time whether some of these, if we see emerging impacts on psychological distress or not. So for us, the time horizon is really important to learn more about that pathway. Now, the other answer would simply be that $4,000, while it's actually 20% of income for these families, it's not $20,000. It's not doubling their income, for example. So it may be that the amount of support that they're receiving really isn't enough to reduce the many challenges that they face and the stress that they feel from those challenges. But we are seeing impacts on time spent with children and money spent on children. So that really does seem to support the investment pathway. Parents are using the money as a resource and are reading more to their kids, which, as Tzipi just explained, can be really important for their development. So that is a sort of stay tuned. But you're right. We are seeing very little to suggest that, at least early on, there are differences in terms of those stress and psychological distress pathways.
Great, thanks. And Tzipi, how does that compare to the studies that you've showed us a couple of studies and studies that you're looking forward and doing? Is the perspective that you're testing more, it seems to be also is the investment model and parental engagement.
So this one? Yeah. Can you hear me? Yeah. Okay. So I think, more time that the parent and especially the mother spend with the child is a pure benefit for the child. However, I wonder how much it is the actual funds that they're getting from, like the study that Katherine shared with us, or is it the empowerment of the parent, that now the parent has a specific amount that now they can make a judgment of how to how to spend this money, how to invest the money that they got on different household needs. I would like to think that, I would really like to think that the parents indeed communicated more with their kids, that they read more books for their kids, and that they bought more home literacy materials, books, games, etc. I'm not sure how much we can be certain that this is actually what happened. So, for example, I would say that I would like, and Katherine, I would love to hear your thoughts about it. I would like to know what will happen if we have, for example, another group of families that get child's goods. So exactly what I was talking about, the books, the materials, maybe some parental guidance of how to read the book for the kid, okay? Because there are different methods of reading the books. In the same amount that the families got the incentives. And then you can really say, is that the funding that that resulted in this increased 6% of communication with the child in home home literacy environment? Or is it the exposure to the amount of home literacy environment that we would like this child to have? So these are my thoughts. I don't know what the answer is. I can hypothesize that, we may get unequal results, because for the family that now got the $4,000 increase in income per year, now they can spend more, they can be more relaxed, they can spend more on food, they can be less concerned about the food and spend some of it on home literacy environment. And the group that might receive increased home literacy environment materials, the child may have more access, but the parents will be more stressed because they could not get the food to the table at dinner. So I'm not sure where it can go. Maybe it will even be equalized. And Katherine, I would like to hear your thoughts about that. What would you think may happen?
We hear this a lot, which is so either wanting to add on a literacy or other type of service training component to the money, or testing it against that. And I completely understand the impetus, right? That it's hard to think that just literally having dollars in your wallet will make you interact differently with your child. And this is why I was trying to set up the stress and the investment pathway as not being not pitting them against each other, because I think one of the things, at least in the US context, is that there have been a number of studies that have really tested a home visiting model that have been focused on literacy. So I'm thinking of the Providence, Rhode Island had the 1,000 words, right? So really focusing on language and literacy as a function of the early work showing the importance of differences, SES differences in vocabulary and language use in homes. And to be honest, those results have been disappointing. And I think the reason is not that language isn't important. And it's not that parents, as you're describing, mothers' interactions with their children are incredibly important for children's development. But the reasons why parents are less engaged with their children have more to do with, or have a lot to do with, I won't say more, but have a lot to do with the daily challenges they face. And so what income can do for families is not only allow them to purchase the books, the toys, but it allows them flexibility. So, for example, they may worry less about having to fix a car. Right? They may have to borrow less money from their parents. They may not be needing to go to food banks. There's just a variety of ways in which having flexible resources that can be used to solve a problem can really then free up that what we call cognitive load, can really free up a parent's ability to sit down and read a book as opposed to put the TV on because they're so, their brain fried, they're tired, is the language we use. So it's complicated, and I don't think we're trying to argue that money is a substitute for time and attention of parents, but I really want to push this because I think that those only focused on parenting and only sort of handing out books and handing out resources and telling parents what to do, at least in the US context, they haven't been as successful as you might hope. And so I think it really requires talking and thinking about, well, why is that? What is it that parents don't have that's keeping them from engaging with their children? I'm not saying cash is the only answer, and we don't know everything yet, so I'm cautious, but I think it's worth finding out if that's really a mechanism that's going to help parents engage more with their children.
Thanks, Catherine. I'm wondering, when you're talking about, the benefits of that cash gift. In your study, you're comparing low-income children in both cases with different cash groups. Do you have a sense of how much of the gap you might be able to close? I know you only have year one brain data to talk about, and how does this compare to potentially other interventions in terms of closing the gap?
I am going to, so the short answer is we really don't know. Let me be careful. It's just too early. We need those later measures to be able to really benchmark. If I sort of bastardize and just take the magnitude of differences that we find and then compare them to the magnitude of differences that you might find between our top 20% and our lowest 20% in the US, it's maybe, so those gaps are about 1.2 standard deviations. We're finding a 0.25 standard deviation. So 20%, 25%, a little bit less. So it's not closing the gap, but that's a really messy way of thinking about it. And I would really caution that this is one of those places where getting the data that we are now in the field collecting is just really important to answer that question. And I'll also say that, the magnitude of differences between low and high income SES families varies a lot across countries and across contexts. There's some great work by Jane Waldfogel, Liz Washbrook, and Miles Korak that does a great international comparison of how these gaps look across countries, because of course, different contexts provide different resources to families at either end of the spectrum.
Thanks, Catherine. I think we want to give it a chance to open up questions to the audience. Back there.
אפשר גם לשאול בעברית אם צריך, ואנחנו נתרגם.
Catherine, hi. I'd like to know, has your group spoken to the women and explained to them about the public library service, which might be able to be a resource for them, not only in books, but there are also cooking classes at libraries, nutrition classes, and also community centers, which aren't available in some countries, and they just might not be aware of them, and that this could really help in the development of their children.
Thank you for that question. We are talking to mothers sort of all the time, but we generally don't point them to other resources. I think many years of working with and talking to low-income mothers, generally, these mothers know much more about the resources available in their community than you could possibly imagine, because they're constantly, trying to figure out, well, how do I get an extra meal? How do I get, extra resources for my children? They're generally very knowledgeable. Now, that said, if the mother were to specifically ask us, I have that they have a particular question or an issue, we have a set of resources that we direct them to. I'll also say, in the context of COVID, we're now, the US is now sort of back in person, but for at least the last, 18 months before a few months ago, libraries were not, a whole range of services were available that hadn't been. So food banks in particular really ramped up, but libraries in many places have been closed down as well. So, certainly one thing I'll say is that the context in which we are studying these cash payments is different than we had anticipated when we started this study.
Hi, First of all, I'm very impressed by your research. I'm just putting that out there, and especially how respectful it is to these families, and assuming they know best what's right for themselves and their children. And it's so easy to fall into intrinsic bias when we're thinking about people of lower socioeconomical situations. And I am very curious about what would be the differences here in this culture, or the same type of study, especially because now we are always opening up the discussion into areas of subsidies and areas of support. And so that would be a very big, I'm just saying that's interesting to me, and I'm throwing it out there if you ever want to make it more international. But no, that was my 2 cents. There's no actual question.
I think I'll follow up on that with a question to Tzipi, actually. If you were to think of such a study in Israel and were to design something, what would you want to see? How would you want to structure it?
Yeah, so first of all, thank you for your comment. Absolutely, yes. I mean, if Katherine needs an international collaborator to run the research here, I think I have lots of participants here that would love to collaborate and I would love to lead. I think that there are some differences in Israel that need to be taken into consideration because, first of all, I was talking about the language. Arabic speakers here in this country, these are kids that are exposed to a phenomena that is called diglossia. Not everyone are aware of that, which means that the written Arabic and the spoken Arabic are 2 different languages. The words sound differently. And so for these kids, they are about to start first grade with a really major gap compared to their Hebrew speakers peers. So I would say that these things need to be taken into consideration. So we will have to have a sample of Arabic-speaking families, Hebrew-speaking families, multilingual families from that are immigrants with a different cultural background. I think that the Orthodox families are super important, another important population that may show a similar socioeconomic status with compared to other groups, but for them, they have more individuals living in one household versus other families with maybe similar socioeconomic status. So can these parents pay the same attention level to the kids as a family with low number of individuals? And I'm not even talking about the stress that is very different in the south and north of Israel compared to the center of Israel. So what I want to say here, that I think that we will have multiple subgroups of individuals. This is how I see it. And I would give the cash and the same exact design as what Katherine suggested in her amazing paper, but I would also add a group with the specific materials that are given with the instruction, because we do see, especially in the NICU with specific populations and patient care for neonatal early birth, that storytelling with the child reduces the stress of the families, both in the mother and the father, and they continue reading to the child even after discharge. So I think that if we take this idea and apply it, we'll give the materials, we'll give the instructions, we may find positive outcomes also for the families that will not get the cash, but will get equivalent goods for their kids.
Leora, there's a question from, I don't know if there's a question from one of our researchers via Zoom from Kirill Schreiberman for Katherine. He's asking whether the longitudinal study will include also looking at children from more affluent families in comparison from wealthier families.
No, and it won't. So we will have measures that we're collecting at age 4 that will allow us to compare with higher SES children. So all of the measures we're collecting have are used in other studies and other populations. So we'll be able to benchmark and compare how the children in our study are doing compared to sort of national norms or higher SES children. But we won't actually be collecting data on higher SES children. So just to go back to the question about how much of the gap will be closed, that will still be sort of a back of the envelope look. And, you know, I think what I can tell you is that this study has been, it's a lot of work collecting these data as to be said.
Absolutely.
And when people say, if you have an international appetite, I would love to do this everywhere, but gosh, I can barely run one study, let alone two. It's you know, it's a wonderful, it's a blessing, this study, and we're so glad to do it. But it takes a lot of work to partner with families in a thoughtful and careful way, and to make sure that the communication with them is good, and the communication of our findings out is good, and the data are good. So maybe when this wraps up, I'll have more time to think about new frontiers.
Well, I think that unless there's any other questions, we'll take one more question and then we'll close it up, and we'll actually hear from Avi some concluding words to the conference.
תודה רבה. אני אדבר בעברית ברשותכם, לפחות אני אבין מה אני אומרת. אני לא בטוחה שהבנתי הכל טוב. קודם כל אני רוצה לברך על מחקר שעוסק בהורים ובמצב שלהם וההשפעה שלהם על הילדים. אין הרבה מחקרים כאלה. כשאני מכירה את השטח, אני מקווה שאני באמת מכירה את השטח. רציתי, פרופסור הורוביץ, לשאול אותך, בשקף האחרון שהראית, אמרת שהמוח הילדי מתפתח בצורה הטבעית, natural, אם הבנתי נכון. האם בכל סביבה הוא מתפתח בצורה טבעית? האם סביבה לא הורית מסייעת למוח, עוזרת למוח, מטפחת את המוח שיתפתח? מה קורה כשאין הורים? כלומר, איך נדע מה ערכם של הורים? או מה ערכה של הורות טובה ומיטיבה? תודה.
Should I answer in Hebrew or in English? What the question was, how can we know what the beneficial effects of beneficial parenting, and if the brain will develop just like it will develop naturally if there is no supportive environment. So בעברית אני אענה לך, כן, כדי שתביני, אחר כך afterwards you see that my brain is like goes half. אני חושבת תשובה לשאלה הזאת אפשר לקחת ממצבי קיצון, ובתי יתומים זה תגובה אחת קיצונית, תגובה אחרת קיצונית מתועדת היטב, ואפשר אפילו להיכנס וככה בגוגל להסתכל עליה. זו דוגמה של ילדה בשם ג'ני, שלפני כמה שנים היא נחלאה, לא התעללו בה, אבל פשוט לא היה לה שום סטימולציה, זאת אומרת היא לא היה לה גירוי סביבתי, היא קיבלה אוכל, זהו. אז היא חיה, הגוף שלה חי, אבל הילדה הזו היה לה פער שפתי, חברתי, מוטורי, שהיא לא הצליחה להתגבר עליו גם אחרי, העמיסו עליה תוכניות התערבות, אבל היא עברה איזשהו שלב קריטי בהתפתחות חישתית ומוטורית ותנועתית, שאי אפשר היה להשלים אותו בגיל 14 כשהוציאו אותה החוצה. עכשיו, בתשובה שלי אני חלילה לא רוצה שישתמע שאין פלסטיות למוח. אנחנו יודעים היום, וזה לא קלישאה, באמת, יש תוכנות כאלה ויש תוכנות אחרות, ואני לא אכנס לזה, אבל המוח הוא גמיש והוא יכול תמיד להשתפר ולעשות יותר טוב. אנחנו יכולים גם בגיל 99 לעשות יותר טוב ממה שהיינו יכולים לעשות קודם, אם נתאמץ קצת, כי המוח הוא כן פלסטי. אבל יש שלבים התפתחותיים קריטיים בהתפתחות של המוח, באמת בעיקר ברמה הסנסורית, שזה ראייה, שמיעה, קליטת שפה ותנועה, שאם המוח לא מקבל, הילד לא מקבל את הגירויים המתאימים, יכול להיווצר פער שהוא לא יוכל להדביק. אז אנחנו רואים את זה במצבי קיצון, כן? קיצון מאוד, ואני מניחה שבמצבים שהם פחות מצבי קיצון, אולי לא לגמרי נראה את זה כל כך צועק, ואולי חבל שכך. כי אז יכולים להיות ילדים שנראה לנו שהם בסדר, אבל אנחנו לא לגמרי רואים את הפערים האלה שהמוח כן רואה. זאת אומרת, אם הייתי לוקחת מצלמה קטנה ומצלמת, הייתי רואה שהרשתות לא ממש עובדות עכשיו אחת עם השנייה בדיוק, אלא מתחיל להיות פער. האם הפער הזה בסוף יגרום לילד להיות לקוי קריאה? אולי. האם הוא היה יכול לשחק כדורגל מצוין, אבל עכשיו הוא לא יכול? אולי. אני לא יכולה לדעת.
רגע.
טוב, אז יש לנו עוד שאלה אחת
כן, אפשר להמשיך את
ואז אפשר
השיחה אחר כך, ואנחנו רוצים לצאת.
בארוחת צהריים.
As Catherine, just one more question for you, and then we'll close. From Zoom, also from our research director, Professor Alex Weinreb. He says a 90% retention rate is really good, but how did it vary between the two levels of cash transfer? And if different, do you have a sense of whether it affected the difference in results between the two groups? For example, perhaps more motivated parents in the low payment group left.
Great researcher question. The short answer is that they our partners at the University of Michigan who are helping us with data collection did a fantastic job, and there weren't differences across the two groups. So both had, I think it was 93.7% response rates. And because we had baseline information, we can compare the two groups. And there was one minor difference, but we're able to use analytic weighting and algorithms to equalize the two groups. So we're really, I love statistics, and so we spent a lot of time making sure that the data were not sensitive to statistics. There's a big appendix on paper.
Sorry, last question. Did the $20 group know that there was a $400 group, or they just...
You know, it's interesting. When we started the study, literally when we started recruiting, they did not know. Because you don't want to sort of, there's concerns about demoralizing, right? They'll be angry, they won't participate, they won't appreciate even maybe the $20. As we got further into the study, we realized that it was getting press coverage in local ways such that mothers in the study were potentially going to find out that they were in the low cash gift group, and that it was far better for us to tell them than for them to hear by reading about it in the paper or hearing something on a radio, TV show, what have you. So we actually went back and started telling mothers about the two levels of cash, and then went back and told those that did get the $20 that they had. Fortunately for us, you know, some mothers were not thrilled, but no one appeared to be demoralized or deeply angry. So it hasn't affected participation in the study. Most moms tell us like, hey, $20, I can go buy an extra pack of diapers. I can fill up not anymore, but I could fill up a gas tank.
Amazing. So wonderful to have this round.
Yeah, they were grateful for the little bit of help. And those that, I mean, I think it doesn't go without saying, but those that are getting the larger cash gift are also quite thankful for the help and support. And they say that to us.
Thank you, Catherine. Incredible to have this groundbreaking study shared with us here in Israel. And Tzipi, thank you so much for your insights. Now, Avi.
Well, thank you all for your interest, and I hope you'll have us. I hope you'll have myself or one of the other PIs back in a few years when we have more to say. So, thank you.
טוב, אני לא אסכם במיוחד, כי זה יום ארוך ובאמת היה מדהים מכל הבחינות, כל כך מעניין. Catherine, your presentation was absolutely fascinating. Tzipi, same. אבל בכלל, כל מי שבאמת הציג היום, כל מי שדיבר היום, כל מי שהגיע היום, כל מי שנקט חלק בסמינריון במשך כל לא סמינריון, בוורקשאפ במשך כל השנה האחרונה, באמת תודה לכולם, ובמיוחד תודה לכל צוות של מרכז טאוב, שטרח כדי באמת לקיים את היום הזה. ואני חייב כמובן שוב להודות לקרנות התומכות, לקרן ברכה, לקרן ברנרד ואנליר וליד הנדיב, שתומכות בכל הדברים שאנחנו עושים בשנים האחרונות בתחום הזה. ודבר אחרון, אני חושב שכולכם כאן מכירים את סוזי, קטרין וניסטי. למי שלא מכיר, היא מנכ"לית כבר הרבה שנים, היא נמצאת במרכז טאוב 10.5 שנים, וזה מאוד 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 לא משמח אותי להגיד שזה הכנס האחרון שהיא תשרת כחלק ממרכז טאוב, כי היא עוברת להיות המנכ"לית של הדסה ישראל, ואנחנו רוצים לאחל לה הצלחה רבה רבה רבה, ורק לחזור על מה שאני אומר, זה כמה אנחנו נתגעגע אלייך, ואני אישית כמה נתגעגע אלייך. ועם זה, אני מזמין כולם לבוא לאכול ארוחת צהריים, ויש מספיק בשביל 3 מנות לכל אחד, אני חושב.